Hello, everyone. Welcome to our sixth Global Healthcare Travel Forum and Conference, which is being held in North Cyprus. Today, we will be having two different rooms. I will be responsible from the room one. We have various researchers from across the world, and in total, we have six different sessions. And right now, we are in this session one, and our first presenter is Dr. Sahar Ebadina Zetat. Tamam, bir deneyelim. We had some technical difficulties. We are sorry for that. So we will be representing Dr. Sahar's presentation again. Um, Everyone, we had some difficulties, so we will be continuing with Dr. Nuriye Sancar.
Morning, everyone. Nice to meet you all. My name is Nasima Hatzadeh, and today I wanted to uh, present our article, which is related to the improved LSTM-based model for forecasting health tourist visits. In health tourism, being aware of the number of health tourists can be useful in developing sustainable health tourism policies by providing the opportunity to determine effective future strategies and, as a result, determine the demand levels of destination. To develop more effective strategies and policies, the use of artificial intelligence forecasting models such as machine learning and deep learning models plays an important role in making future forecasts in light of time series data. Health tourism is recognized as one of the sectors that grow dearly in the world and also Turkey. Expanding the tourism sector activities of the countries that are particularly prominent in the tourism sector to every month of the year creates an opportunity to improve the sustainability and effectiveness of the health tourism. Turkey, one of the countries with enormous opportunities for medical tourism. Also, Turkey attracts attention to the in the international arena with the quality health services. It offers expert health professionals and modern medical infrastructures. Today, new trends in technology, especially technologies and systems in the field of artificial intelligence, have positively affected all sectors. It seems that it has caused a great success in both diagnosis and intervention, especially in the field of health. Commonly, used artificial intelligence models include the machine learning like XGBoost, RF, and etc. And deep learning models is like LSTM, GRU, and etc. The aim of this study is to propose an artificial intelligence-based model that will forecast health tourist visits utilizing a null-time series data supplied by uh, Turksat, which shows the number of health tourists visiting Turkey between 2015 and 2023. In this study, the dataset that was collected by the Turksat and shows the number of health tourists visiting Turkey between 2015 and 2023 was applied, and because the COVID-19 epidemic that happened in 2020 affected the tourism sector more around the world, especially Turkey, there is a reduction in the number of incoming health tourists. So, the number of tourists during the epidemic was estimated by the model and applied to the dataset to get the more accurate and reliable analysis. As you can see in this diagram, Uh, we show the income obtained from health tourism and according to the dollar. And the next one is showing the number of health tourists which have visited Turkey. Let's talk about the proposed method. Long short-term memory, or LSTM, is an algorithm of deep learning and performs well at processing sequential data, especially time series data. Also, stacked LSTM is improvement of this algorithm. It means that the deep learning and LSTM algorithm, which the different layers on top of it causes to get the better and deeper result. Applying several LSTM layers to those to see the increase in the ability of in the use of the pattern of time series in our dataset. As you can see in this slide, this is the proposed model diagram, and it shows the model was made of how many layers. I want to explain you or give you a brief explanation about the proposed model. After definition of the input shape, the model is made of three LSTM layers which has different kernel units. The output of the last LSTM layer going through a dense layer with activation function and following each LSTM layer, drop-off layers with a 0.5 drop-out rate are added to apply during training with the goal of preventing overfitting by randomly with removing a fraction of input units. The output of the last layer flattened and also passed a softmax activation function, and by adding the softmax layer to the model, the scores sum up to the 1. And also in this slide, you can see the detailed information about the parameters and layers of the suggested model. Let's talk about the experimental setting. The system we already run and we already performed our code. It has i5 core CPU and it's made of 64 gigabyte RAM. And also the proposed model was implemented in Google Collaboratory, a hosted Jupyter Notebook service, and the Python version is 3.10.12, and the TensorFlow version is 2.12.0. In this model, we used several metrics for evaluation, which used to compare the performances of the existing models with the improved proposed LSTM-based model. The mean absolute error, or MAE, assesses the variation between the expected and observed values. The mean square error, or MSE, calculates the square root of the mean square deviations between the expected and actual values. The average percentage difference between the expected and the actual value is determined by the mean absolute percentage error, which is called MAPE. and it gives a relative measure of accuracy by expressing errors as a percentage of the actual values. As you can see here, the table illustrates the forecasting performance results of the models applied to the health tourism dataset. As the real performance of gated recurrent unit or GRU and LSTM is comparable in lots of cases. The GRU increases efficiency immensely and is simpler to train. The GRU was applied to the dataset and include a variety of features and target variables. The obtained values for the RMSE is 0.992. For MAPE, we got 0.536, and for the MAE, we gained 0.491. Additionally, the LSTM model was implied and produced the subsequent metric outcomes. An RMSE of 0.618, a MAPE of 0.661, and MAE of 0.615. XGBoost is another effective choice for a variety of applications such as time series forecasting, structured data analysis, and machine learning contests due to its high efficiency, scalability, and adaptability. So it was used on the dataset. The achieved results are 0.655 for RMSE, 0.702 for MAP, and 0.654 for MAE. The proposed model, which merges LSTM and attention layer, demonstrated quite better performance compared to other models. Especially, it achieved an RMSE of 0.474, indicating a notably reduced average in error magnitude. The MAPE stood at 0.507, signifying a substantially lower percentage deviation between predicted and actual values. Additionally, the MAE registered at 0.472 and highlighting a significantly diminished average error magnitude between predicted and actual values. As a conclusion, I can explain you health tourism contributes not only to the healthcare sector but also the economy by enabling people to travel to different countries to receive medical services. Knowing the number of health tourists plays an important role in tracking the development trend of the healthcare sector and understanding the demand levels of destination. Therefore, this study aims to create a time series model that best predicts future health tourist numbers using health tourist data from Turkey between 2015 and 2023. According to comparison results, the developed LSTM-based model outperformed other models in forecasting performance. Health tourism stakeholders can use this model, LSTM-based model developed in this study to predict future health tourist arrivals in Turkey and as a result, optimize capacity management by planning the most effective marketing strategies. There was some limitation in our article, and one of them that was the significant one that was related to our data set, which was annual rather than monthly. So maintaining monthly records of health tourist arrivals to the country is so crucial and for ensuring more accurate resulting models forecasting the future. Therefore, it's imperative for health tourism authorities to initiate efforts to develop a system that track monthly health tourist arrivals to the country promptly. Thank you for your attention. Thank you for your listening.
Thank you, Dr. Nasin, who presented on behalf of Dr. Nuria Sanjar. Our next presenter is Dr. Sahar.
Hello everyone, welcome to the conference of GHTF 2024. I'm Associate Professor Dr. Sahar Bedinirad, and my paper is about addressing security concern in IT-enabled smart health system, which is a review. First of all, I want to talk about the abstract, then introduction, then I talk about IT in a healthcare and healthcare system. Then we will talk about some segments of IoT-based health system. And then I will talk about security concern that we find out based on this review related to the IoT-based health system. And at the end, I will give you a discussion and recap this conference. So, as we start, we know that IT is Internet of Things, and generally IT and smart medical devices, they have significantly revolutionized the healthcare industry, particularly in areas such as capacity to remotely screen and monitor the patient's health condition at any time from any location. So as we see, due to the emergence of the novel COVID-19 over the past few years, actually, definitely there has been unexpected and some causal increases in the number of the patient worldwide. So the healthcare industry, as this is under significant pressure to provide high quality services to the patient and to the physician worldwide. So for ever-changing and overwhelming healthcare demands, definitely IT is a lifesaver. That's why this research, it provides comprehensive overview of how the Internet of Things has influenced and aided the healthcare delivery. Service include a smart health system, security concern, its solution, and also the addressing the privacy issue here. So, as I said before, the methodology that we applied here is a literature review, is a survey, and we applied some keywords definitely in order to conduct this survey, and the keywords should be based on definitely the topic that we applied. Remote patient monitoring, healthcare delivery, security solution, privacy concern, of course, and other keywords. As the introduction, I can mention that according to the World Health Organization, online medical services have become possible in recent years due to the rapid growth of the Internet of Things, rapid growth in medical sensors, and also the Internet applications. So this is important to note that the number of elderly people that they suffer from the chronic disease increases annually, and an elderly population model is one in which the portion of the elderly population it reaches or exceeds certain threshold. That's why we're concerned about that mostly here. So many researchers, they actually they propose a different kind of services. They propose different frameworks. For example, in one of them, and which it was in the paper, you will see it was our first citation that we put. They define a cloud as extensive network, and they said that it's totally externally located, and it interconnected the computers. So as we see, it's a paradigm shift from the traditional desktop computing strategy, which, as we know, it permitted the software program to run on each machine. And in addition, Health Cloud is a network of computers and networks of the servers that are actually dedicated to meeting the needs of the healthcare industry. And the healthcare services is actually provided to the user who may be physician or maybe patient via the internet. So as we see, the IoT is an ever-changing distributed system, which is composed of interconnected set of physical objects, automobiles, household appliances, that have sensors that installed in order to gather and analyze the real world data, to process them and to share them, or let's say export them, and export the result of them with the others. So as we see, the ability to identify, communicate, and interact with anything from electronic devices to living, it starts and is exactly what this network is apart from the others. So this structured transaction, it can be carried out actually in a real time by IoT devices. How? By connecting them to the internet. So internet connectivity also, as you know, it enables the remote monitoring of the devices through it, and it's possible to add a wide variety of the sophisticated and cutting-edge functionalities to this kind of device. So we can look into IoT in healthcare and healthcare system, actually, which I want to talk about. First of all, IoT in healthcare. We can mention about the widely used of the IoT in industry like manufacturing, healthcare, and telecommunications. And definitely because of a rapid growth in applications in healthcare, it enabling wearable devices and health and community healthcare as well. So as you see, IoT in healthcare, it enables different services like patient monitoring, like mobile health, and smart living. And beside that, IoT, in the healthcare sectors, it utilizes the wearable technology for monitoring of a body temperature, or monitoring the blood sugar level, or ECG, or even more. So as we see, IoT in the health sector is the aid in the emergency medical services and for patient data security. I would love to talk about the benefits to the healthcare here. One of the benefits that I can mention here, definitely it has lots of benefits. One of that is, for example, is enhancing the quality and enhancing the cost effectiveness of the healthcare services. It provides better care, more precise diagnosis for a patient also. Another benefit is establishing the automated communication between a patient and a practitioners. And also it can incorporate wearable technology for monitoring the blood pressure, for glucose level, and definitely more. So another actually importance in IoT in healthcare that I would love to mention about it is a smart healthcare system, which exactly it uses the biometric sensors to gather the patient health data. It enables the patient and practitioners to interact through the IoT cloud. And definitely IoT devices, they transmit this real data to the healthcare portals, and the implementation of different kind of examples in these sectors, definitely including using some microcontrollers like ATM 80 Mega 32 8P or Node MCU with the different sensors and definitely different other microcontrollers. Also, there is a data storage here. For example, they can use different databases, MySQL database servers, in order to connect to the real-time healthcare portals. And definitely, all of these are accessible through Android application, which it developed in Java or on different devices also. And if you want to talk about the connectivity of that, definitely this kind of connectivity is via internet for real-time internet data transfer. But in summary, I can say that we want to actually here, based on this survey, we outline the widespread adoption of IoT in healthcare and also its impact on patient monitoring, the benefit to the healthcare system. And we brought different examples of IoT implementation in real-time healthcare portals. Since I'm mentioning about the real-time health portal, I can say that it's one segment of IoT-based health system. And this is a Java-based healthcare portal that allows user to view the data. And it's accessible through Android application on a variety of devices, including PCs, tablets, mobiles, laptops, and application for Android that would notify a mobile user if patient's health fluctuated would be one of the examples of that. Other segments that we have in the IT healthcare system is a data acquisitions, and this is actually a sensor that used for capturing the data from the patient or healthcare units. And some example of these sensors are the DS18B20, which this sensors is used for capturing the heartbeat value. Another microcontroller that I can mention here as an example is Arduino 80 Mega32 8P, which this microcontroller captures the body temperature data. So we have definitely different microcontrollers, different sensors. And another segment is the cloud system, of course, that is needed for this every framework that it want to propose in IT-based healthcare system. Because by using the Wi-Fi module, definitely all the data can obtain from sensing devices and it can be sent to the processor like HLK, RM00 serial that we have. And this microprocessor, it actually can be saved on MySQL server, for example, or we can have a HTTP protocol that it can be used to establish this connection or any other protocol, of course. Now I would love to talk about security concerns, of course. So much more detail of the security concerns, you can find it in our paper, but here I just summarize some of them. I didn't mention about all the security concerns here. One of the issues that I would love to talk about is security issue for personal protection, meaning that ensuring the information security, it should balance the individual privacy and safeguarding sensitive data. So IoT networks, it actually transmit the vast data, potentially private, and it upgraded the devices that offer the opportunities, but also risk to the personal well-being and data integrity. Another challenge that here I mentioned about it is addressing the privacy issue. You know that patient data, all they stored in IT databases, which it raises the privacy concern, of course. For example, ABE with MD5 or with the AES encryption. These kind of algorithms, encryption algorithms, they can ensure the secrecy. But sensor data sensitivity, it can determine the privacy domain. So decentralized cyber attack detection is very crucial. That's why we're addressing the privacy issue in detail in our paper. So there are different techniques like body-coupled communication, secure data like encryption method, like different IEEE standard, which they can strengthen the IoT security for this kind of devices and platforms. And the last things in this slide that I want to mention about it as a challenge of security is security for communication technology and applications. So communication technologies, we know that it faces different kind of threats like black hole, homing, flooding, DOS attack, and they're vulnerable to code injection, data theft, man-in-the-middle attack. So as we see, intrusion detection encryptions like DS, AES, ES, and other different authentication protocol or cloud-based IoT security. These kind of protocols, this kind of solutions, they can actually safeguard against malicious access and manipulations. As a discussion, we brought much more detail definitely in the paper. I just summarized it in this table here for you. As we see, the combination of IoT and smart medical devices, it has transformed the healthcare, especially with remote patient monitoring. And as I mentioned at the beginning, after COVID-19 pandemic, definitely there is a need for continuous health monitoring to lead to surgeon-sensitive health data. Many researchers in the literature, definitely they focus on cloud-based IT technology for secure the health monitoring using lightweight block encryptions for, let's say, detection for early diseases. Additionally, there are open source data mining platforms that they are enable the rapid algorithm developments. So there exists of a different kind of a module architecture processes that those modules they have vast sensors data. They can analyzing the conditions like asthma, like hypertension, and many more symptoms. And IT sensors generally, as you saw, they track the activity of the patient, improving the overall well-being of them. And this convergence, it actually promises enhanced of the healthcare delivery, especially for risk detection in elderly people. So as you see in this table, I provided the overview of a related survey that actually is done on a cloud-based IT in the same field. And in order to recap this paper, I can say that this evidence from these studies, extensive findings and discussion that we did, that the creation and assessment of the IoT patient monitoring system in conjunction with the robust framework, it actually can ensure the secure data transmission and can represent significant advancement in medical technology. So the suggested system underwent some refinement and validation through the series of the phases during this research journey. And it actually harnessed the strengths of the advanced synthetic artificial intelligence strategy, which include deep learning with a deep into getting to know the convolutions, neural networks, CNNs, recurrent neural networks, RNN, in order to enhance the accuracy, enhance the robustness, enhance the interoperability of the fitness statistic evaluation and prediction fashion. Also, through this study, we provided some recommendation as developing the AI push decision guide system and some scientific decision-making equipment to be used in order to be able to integrate a multi-model records to be actually secure, and these models, they can actually supply some actionable insight for healthcare in order to provide to the provider, to the patients, and to the people that actually they suffer or they might suffer from the other disease if it's not in early detections. Also, we investigate the application of a blockchain era and decentralized ledger systems. And in the future, definitely these systems, it can be established on a obvious fact sharing systems for a healthcare record alternate. And it can ensuring the record integrity, the provenance, and the auditability. Thank you everyone to listen to this conference, which is this part of that related to my paper. Thank you everyone, and you can see more detail in our paper.
Thank you, Dr. Sahar Ebadineshat, for your presentation. Our next presenter is Dr. Cemile Şeker.
Hello, dear participants. My name is Cemile Şeker. I am a lecturer at University Faculty of Tourism. Thank you for your interest in my article. The subject of my research is the effect of communication anxiety, which may arise from communication problems on the economy of health tourism. Effects of communication anxiety on the health tourism economy. Many countries around the world have realized the potential of health tourism and developed their infrastructure to compete in the sector. Given that health tourism can be an important source of income for both health service providers and the tourism industry. With the increase in competition, countries need to constantly improve service quality, ensure patient satisfaction, and especially minimize patient communication concern in order to compete in the health tourism industry. One of the most common problems among the obstacles to medical tourism is the communication problem caused by language differences. This problem may cause some communication concern in patients. This concern may negatively affect the patient treatment process. Medical tourists receiving health services in different countries may experience various difficulties due to cultural and language differences. These difficulties might cause definition in the question asked and the answer to this question during the diagnosis, treatment, and rehabilitation process. This may lead to a negative impact on the communication process, a decrease in the understandability and effectiveness of the service provided, a decrease in patient satisfaction, and even failure of the treatment. Additionally, the meaning attributed towards different from culture to culture, which can negatively affect the communication process. While a word may have a meaning in one culture, it may not have any meaning or have a different meaning in other culture. However, healthcare providers' use of technical terminology during the treatment process may make it difficult for medical tourists to establish healthy communication with healthcare professionals. All these language barriers can affect various aspects of medical tourism and change patient access to healthcare services, satisfaction levels, and costs. As a result, language barriers can affect various aspects of medical tourism and change patient access to medical care, satisfaction level, and cost they will have to bear. Language barriers, not only in medical tourism, but also in health tourism in general can cause communication problems, and communication problems can cause communication anxiety, which can negatively affect patient loyalty and satisfaction. It is in this context, communication anxiety, it will negatively affect the health tourism economy in countries and harm the country's economy. The contribution of health tourism to the country's economy are too important to be ignored. Health tourism is very important for the economy of developing countries such as Turkey. Actually, there are a lot of titles. Providers disposable funds for healthy, determines the employment areas, provides a strong country image and significant prestige in the international area. It can provide positive sociocultural interaction. The aim of this study is to underline the importance of patient communication, concern, and their impact on health tourism economy. Thanks to the health tourism diversity and competitiveness in the tourism sector of a country or region can increase. Countries that offer health tourism can have a say in these fields by specialization in health services and gaining a competitive advantage and in the international area. Health tourism can contribute to the country's economy by increasing the export of health services, foreign patients receiving service from local healthcare providers may positively affect the country foreign trade balance by increasing foreign exchange inflow. Thanks to the healthy tourism to economic development of region where health services are provided can be strengthened. Health tourism can provide income and job opportunities to local people and contribute to the tourism sector by reducing regional imbalance. Thanks to the healthy tourism, investments can be made to develop and improve the health infrastructure. These investments can improve the quality of healthcare and the over effectiveness of the healthcare sector. Medical tourism can offer employment opportunities in healthcare, tourism, accommodation, transportation, and other related sectors. Tourism income may increase with the money frame patient will spend on health services. This income can contribute to the country's economy by flowing to healthcare institution, healthcare professional, and other related sector. For this reason, the contribution of health tourism to the country economy cannot be ignored. For all these reasons, it is important to eliminate communication anxiety, which is thought to negatively affect the healthy tourism economy. The reason for preparing this research is that as a result of the literature review, it was determined that the studies conducted both abroad and domestically and on the effects of patient communication anxiety on the health tourism economy were not sufficient. For literature review, indexes such as Google Scholar, Science Direct, and Web of Science were scanned, eliminate the problems arising from communication concern in health tourism will contribute to the country's economy. For this reason, this research is especially important for the economic of developing countries such as Turkey. In addition, one of the factors that makes the research important is that it will provide advice to individuals and institutions in order to eliminate communication anxiety. Tourism activity that includes medical treatments and activities to increase tourist satisfaction is called health tourism. Economy is human activity consistent of production, trade, distribution, and consumption, imports, and exports. It includes all kinds of activities to meet human needs. Health tourism economics can be defined as a concept that examines how a country's demand for healthy services is affected economically, economically through health tourism, and how these affect contributors to country's economy, the employment creation potential, the income generation effects of health tourism service, and the size of the health tourism market. Anxiety is defined as the state of feeling worried and uneasy about a subjective situation that is unlikely to happen. Communication anxiety is a common characteristic that occurs with fear or anxiety that arises in some communication efforts with other people. The aim of the study prepared by Büyük is to examine the effects of cultural differences and language barriers on medical tourism. As a result of the research, it was concluded that cultural differences and language barriers that may arise in medical tourism can significantly affect the expectation, preferences, and values of medical tourists and medical tourism professionals, and that these differences and barriers can lead to communication problems, unsatisfactory interactions, and inadequate service provision. As a result of the research, the following succession are present to solve communication, maybe problems in medical tourism. Improve qualification of translators, increasing the accessibility of translation, or reduce the cost of translation services. There are a few studies in the literature about the effects of problems arising from communication problems on medical tourism. In summary, communication problems can prevent patients from communication effectively with their healthcare providers, failures to communicate clearly about patient health condition, treatment process, and expectation can negatively affect patient trust, patient satisfaction, and may affect collaboration between patient and healthcare providers. Conclusion, communication problems can cause communication anxiety, and communication anxiety can negatively affect the health tourism economy by causing various negative effects on health tourism. The following inferences can be drawn based on the results of the studies obtained from the literature review. Communication problems can prevent patients from communication effectively with their healthcare providers. Failure to communicate clearly about patient health condition, treatment process, and expectation can negatively affect patient trust and satisfaction, and prevent effective collaboration between patient and healthcare providers. When the patient cannot receive detailed information about the treatment process and treatment plan or cannot express his concern, treatment compliance and success may decrease, preventing patient from fully understanding the risk they may encounter during the treatment process. Patients who cannot receive information about the potential risk of treatment and possible complication may have difficulty in this decision-making process or may be hesitant towards treatment and communication problem may thus turn into communication anxiety, negatively affecting quality of healthcare. To reduce or eliminate negative effects of communication anxiety on healthy tourism, the recommendations mentioned below may be useful. Healthcare providers and healthcare personnel should be aware of communication concern, be sensitive to this issue, and treat on this issue if necessary. Given that communication and sensitive training can help healthcare professionals understand patient emotional and psychological needs. In this way, the health tourism economy can be developed by reducing communication anxiety. Healthcare providers and healthcare personnel must create a safe environment for patients, providing an environment where patients can competently express their values and concern can eliminate. Healthcare providers should take patient feedback in the consideration and use that feedback to continually improve their communication process. Surveys can be conducted to evaluate patient experiences. It will not be correct to make definitive inferences in social sciences, because in social sciences, whether quantitative or qualitative studies, the result require repetition. Given that different results can be I am sorry for that, obtained from different universities or population. It is recommended that the results obtained from this study be tested, maybe with research that combines qualitative and quantitative studies. Thanks for your time.
Thank you very much, Dr. Cemile, for your valuable contribution for our conference. So, thank you for all of our authors.
Thanks for your time. I am sorry, my voices.
It was perfectly all right, Cemile Hocam. So this is the end of session 1, and we will be holding session 2 at 10:30. Thank you very much for everyone's contribution.
Catching a bus, never nothing when it's real when it does. I'm flying up.